For nearly 4 decades, I have dedicated my career to working with Lyme disease patients, navigating the complex challenges and triumphs that come with treating this often misunderstood illness. Throughout my journey, I have encountered unexpected obstacles, not only from the disease itself, but also within the medical community. These experiences have profoundly shaped the way I think, live, and advocate for my patients, pushing me to take bold action in the face of adversity. When I first began treating Lyme disease, I quickly realized the harsh realities of its complexities. Lyme disease is not just another tick-borne illness, it's a condition that can manifest in myriad ways, often eluding straightforward diagnosis and treatment. However, what surprised me most were the challenges that came within the medical community. Some colleagues were hesitant to accept the nuances of chronic Lyme disease, while others were resistant to adopting new treatment protocols. Yet these challenges taught me an important lesson. The fight for better Lyme disease treatment isn't just about medical complexities, it's also about changing perceptions and challenging the status quo. Through these experiences, I developed a guiding philosophy: it's better to take decisive action, sins of commission, rather than regret missed opportunities, sins of omission. In the world of Lyme disease, the stakes are simply too high to stand by and do nothing. I've witnessed far too many patients suffer because they didn't receive timely or adequate treatment. This is a reality I refuse to accept, whether it's advocating for more comprehensive treatment plans, pushing for groundbreaking research, or educating both the public and my medical peers. I've always chosen to take bold steps. Inaction is not an option when it comes to the well-being of my patients. This approach hasn't been without its challenges. I've had to step out of my comfort zone, face criticism, and sometimes stand alone in my convictions. Yet the reward, seeing my patients improve, witnessing the validation of my clinical practices through emerging research, and knowing I have made a tangible difference, have made every challenge worthwhile. The path has been fraught with resistance, both from the disease's complexities and from the skepticism within the medical community. But each challenge has only strengthened my resolve. There have been moments of doubt, times when the way forward seemed uncertain, yet the needs of my patients have always guided me. Their stories, their pain, and their perseverance have been the driving force behind my work. Each time a patient who was once deemed, quote, untreatable, unquote, makes progress, it reaffirms my commitment. Each new study that aligns with my clinical observations is a reminder that pushing against the grain is often necessary for progress. And as I reflect on my journey, I see my work not just as a career, but as a calling. I believe that I have been placed on this path for reasons I may never fully understand, but it's clear to me that this is where I am meant to be. The unpredictability of life has led me to this purpose, and I embrace it with open arms. I am deeply grateful for the support and guidance I have received along the way. Thanks be to God for giving me the strength and clarity, even when the road has been rough. It's a calling I am proud to answer, and I am committed to continuing this work as long as I am able. In the end, I know that my work is about more than just treating a disease. It's about connecting with people, understanding their struggles, and making a meaningful difference in their lives. For that, I am profoundly thankful.